I'm going to let you say your name.
Lindsay Ricciardi.
And you are?
A licensed clinical psychologist in Las Vegas.
In Las Vegas, and a very pretty one, I might say.
Thank you very much.
But we were just discussing about relationships and bariatric surgery, and I was going to tell you, and I was going to get your feedback on the fact that I get hundreds of emails where the lady loses the weight and the guy is not saying anything, and she's saying, I am so mad because he's not noticed, everybody else has noticed him, but he doesn't notice me. And of course we know that he is scared to death because his formerly fat, safe wife is changing before his eyes, and he's not so sure he's going to be able to keep up with that. And I am just amazed at how many people don't know this, and so then they build resentments and they go apart. I mean, what do you foresee is what we can do, I mean, to get this word out, to help save these relationships?
Well, you bring up a lot of things, right?
A lot.
But that is a very common issue. Something I hear a lot from a lot of patients who've lost a lot of weight. One of the interesting things too, to add to that, is a lot of people coming into surgery expecting that it's going to make their marriage or their relationship better.
Kind of like having that baby that's going to save the marriage.
Exactly.
Yes.
Same concept. But the reality is it just rocks the boat big time. A lot of people are fortunate that there's a lot of positive changes,
yes,
so they can go out and do more activities with their partner,
children too,
play with their children.
Right.
That's why a lot of people come in the first place. But some people, knowingly or not, choose people to be with because they fulfill a need within themselves.
Yes.
And so the situation that you're talking about, oftentimes obesity stabilizes marriage.
Yes.
Because, you know, if I'm insecure, she's never going to leave me because she feels bad about herself, and she's putting that out to the world that she feels bad about herself. That's and insecure. So she starts losing weight, and wait a second, she's putting on makeup and hasn't done that in 15 years.
Yes.
She's buying new clothes.
Yes.
She's got a push-up bra. Come from. And so a lot of times partners,
Victoria's Secret. Yes.
And partners become very insecure. And you know, what I've always emphasized with people is that they need to talk about these things with their partners long before they have the surgery, because they come up in the best of marriages.
Yes.
Now, nationwide, we have over 50% divorce rate.
Right.
So, you know, even though we see a lot of divorce with the surgery population, it's just as prevalent out there. There aren't good statistics as far as, you know, to what extent it's surgery or not. But definitely it creates conflict in a lot of marriages because it takes out the security. And sometimes too, I will say, sometimes it's the best intentions, and I think even healthy relationships will have that. But oftentimes when marriages are built on that insecurity and on that obesity, divorce or separation is a very good thing and a very positive thing. I can't tell you how many people I've talked to that have gotten the strength and the courage and the independence and the confidence to leave an unhealthy relationship.
Absolutely, because there are those times when, you know, heavier women will settle
for whoever will love them and give them attention.
And so we have that too. And so, you know, we need to have somebody that can come and tell us which situation is which one, you know, and ask them the important questions. You know, to say, like, you know, is it built on this insecurity? And I've seen that too. And I know there was a guy that weighed a whole lot, and his wife was so comfortable with that because she knew he wouldn't leave. And how sad that he was going to die early because of that. Right.
Relationships, healthy relationships, are not built on the fear or the security of knowing somebody won't leave you because they can't. It's based on the security that somebody's not going to leave you because they love you and they want to be there and work with you. So oftentimes we think that, oh, surgery is a bad thing because it breaks up marriages. Usually those marriages that are falling apart are falling apart because a person's becoming more healthy.
Exactly. And that's a great thing.
That's a good thing.
We, off camera, we were talking about the sex word and bariatric situation. So what did you want to bring up on that?
Well, you had said that sometimes people, when they start to lose weight, let's face it, sex gets a lot easier and a lot more enjoyable when you can return to positions that you used to do or never got to do because of your weight. So physically, sex becomes much easier and a lot more enjoyable to some extent. But what's interesting is I did one study where an overwhelming majority of the women who were in partnerships prior to surgery lost interest in sex with their partner.
Wow.
And there was a lot of reasons that they talked about, but one of the big ones was body image. That some women felt a lot more comfortable being 300 or 400 pounds, but filled out, than they did with hanging, sagging skin. And so that was one issue.
My answer to that was to go to a nice store and wear a bra in bed. Because you know what? You are thinner, but it puts everything, it covers up the part that you don't like, and it makes such a huge difference to me.
That's a great idea.
So continue on. I just wanted to put that in.
I like to have suggestions for people, and I think, you know, if you could find something that you feel comfortable in wearing that allows you to still feel sexy and appreciate your size, because I think people said, like I said, people said they felt more comfortable at 400 pounds than they did at 200 pounds.
Yes.
So that's a great suggestion.
Thanks.
Another thing that
I got a compliment from a doctor. Wow.
Another thing that happens with sex is that the partner who looked really good before surgery isn't looking so good now that all these other men are giving you compliments, and so that's what a lot of women said is like, you know, I had more feelings because I felt like that was all I was going to get. That was where my options ended.
Right.
Another thing that women said was that they, you know, after surgery, they didn't realize that they were going to have their stomach cut but grow a backbone, and so they became more assertive. Yes. So when they weren't necessarily in the mood for having sex and in the past would have said, all right, now they're more likely to speak their mind.
Amazing.
And then there's some research that said that there might be something hormonal going on too.
I believe that.
Between fat cells and estrogen. But again, that's an area that hasn't got a lot of research attention. Right. But I found it really interesting because I think that people in the world would think, oh, you get skinny, you have better sex.
Not necessarily.
Not necessarily. And you know, I tell people it's easier sex. It doesn't mean you want it more. That's one of the things that I think gets neglected in the treatment of overweight, whether it be 50 pounds or 400 pounds. People are going to have those residual effects psychologically, emotionally, in terms of their self-esteem, and just, you know, their body image.